Hi everyone! Today we'll be discussing the topic of fostering cultural competence in the healthcare setting. My name is Emily Huffman.
And I'm Judith Okwamba.
Okay, let's get started. Cultural competence is an important concept in healthcare that has been part of the discussion since gaining prominence in the late 20th century, and it's a critical element in working towards health equity. Understanding culture as a social determinant of health changes how we may approach communication and provisions of care, and how we address health disparities. When considering how to create a culturally competent environment in a healthcare setting, the first barrier is often a lack of clarity on the concept of cultural competence. Here you can see there are a lot of terms that can seem similar and confusing, especially if you're new to these concepts. But these are important principles to delve into and differentiate. So let's break each of these down. First, let's consider culture. When we think of an individual's culture, what does that include? What characteristics of a person comprise their culture? What are we really talking about? Culture encompasses history, traditions, values, family systems, race and ethnicity, immigrant and refugee status, tribal groups, religion, spirituality, sexual orientation, gender identity or expression, social class, mental or physical abilities. And culture is dynamic. It changes and evolves over time based on interactions and influences in our lives. Consider your own culture. What traits and characteristics are specific to you in your life? How do those things shape how you see the world and make decisions? Culture is central to patient care because it shapes health-related beliefs, values, and behaviors. So what is cultural competence? It's a broad concept that involves a lot of underlying principles, but essentially it's having ability to understand, respect, and effectively interact with people from diverse cultures, backgrounds, and beliefs, and then being able to demonstrate that through provisions of care that recognize, affirm, and value the worth of individuals, families, communities, and protects and maintains the dignity of each. One article describes cultural competence as a process rather than an outcome, which is a great way to view it. The idea of needing to master everything about all cultures is really intimidating and even overwhelming. But if you think of it as a journey of learning and growing over time, there's room for grace and also the idea that there's always room for improvement. Cultural awareness refers to the ability to recognize, understand, and respect the beliefs, values, customs, practices, and behaviors of individuals from different cultural backgrounds. It involves being mindful of one's own cultural perspectives and biases while actively seeking to learn about and appreciate the diversity of others. Being culturally aware in the healthcare setting fosters an environment where everyone feels valued and respected, provides for effective communication, and ultimately improves health outcomes. Building upon cultural awareness, cultural sensitivity is simply being aware and then acting in a manner that is respectful and accepting of differences in order to better understand our differences. Cultural humility is a self-first approach to cultural differences, involving learning one's own biases as a means to becoming more accepting of others. It's viewing oneself as a learner of other cultures rather than an expert. Cultural humility is a lifelong process where you seek to examine personal background and how it impacts interpersonal interactions, reflect on how interpersonal interactions are impacted by biases and perception, use active reflection to gain a deeper understanding and respect of cultural differences, and recognize areas where there's a lack of experience and demonstrate willingness to learn. Cultural responsiveness is putting cultural sensitivity, awareness, and humility into action. It's essentially practicing a mindfulness and respect of cultural differences and interacting with individuals who are culturally different in a way that reflects that. So individuals who are culturally competent can be culturally responsive, which is exactly what we seek to achieve in the healthcare setting in order to bring about health equity.
So now that we have defined these concepts, where do we start with trying to foster these principles in the healthcare setting? Training healthcare employees within the workplace is an effective way to utilize cultural competency to bridge gaps that exist. Just as it takes purposeful action to adapt these principles on an individual level, a team must also take concerted steps to integrate and implement them effectively in practice. The Cultural Proficiency Continuum is a framework that has been used to assess progress in cultural competency. The continuum can be used as a tool to determine where someone is in the process and allows you to tailor trainings and education to the specific needs of those on your team. There are a lot of different ideas on exactly how cultural competence should be integrated into practice. We'll review different strategies that are being used and discuss what we know about the success of these different methods based on literature. So in order to cultivate cultural competence, we need to start by identifying what strengths and weaknesses exist using assessment tools made for the clinical setting, like this one from CPPE. The National Center for Cultural Competence, otherwise known as NCCC, has a number of assessments that are tailored to organizations and patient populations, like for personnel providing services and support to children with disabilities and special health needs and their families, or personnel providing primary health care services. The NCCC even provides guides for these assessments as well as educational and planning tools. Next, we must consider barriers to developing cultural competence, patient-focused communication, such as inadequate language. For example, research shows that difficulties in communication and language barriers are a key challenge to achieving inclusive patient care in the community pharmacy setting. In response to this barrier, some studies have found computer-based translational services to be both easily accessible and helpful, but they are not often used in the community setting. This finding has spurred further research and also creative developments like software that produces bilingual prescription labels. Other barriers might include fear of being misunderstood or a lack of knowledge of a culture or a community. Additionally, literature suggests strategies such as maximizing diversity in employment, especially in leadership roles, and implementing training programs for employees, such as workshops. Another strategy is through education within professional programs in schools. A study that observed the perspective of pharmacy staff on cultural competence training found that participants realized the value of such trainings, but had minimal or no experience with cultural competence training within their professional education. This idea is repeated through many studies and underlies the utility of education within pharmacy school. The goal of education and training, whether for employees or student pharmacists, is to instill the principles of cultural competence, empowering healthcare team members to strive for health equity. As I mentioned before, a tool that is often used for training employees is cultural awareness workshops. Studies note that workshops help increase cultural understanding, promote diversity and inclusion, and result in improved communication. Some drawbacks noted in literature are time and cost constraints and limited long-term impact. Some have argued that a finite workshop alone is unlikely to change behavior or an institutional culture. However, many resources, including the NCCC, addresses this limitation by suggesting that workshops and other assessments be used routinely. Furthermore, studies show that a greater impact is seen when a combination of different methods are used. So some questions that we would like you to reflect on and respond to are: what barriers have you seen individuals or organizations face in achieving a culturally competent environment? Do you have examples of a cultural miscommunication in your workplace? How was it resolved, or how could it have been resolved better? And what role could you play in promoting cultural competence in your workplace? Here are our references. Thank you so much for your attention, and we hope you learned something today about fostering cultural competence.